Hi, Dr. Jackson. How are you doing?
Dr. Lanier, I'm doing very well, thank you.
Good, good. Well, I wanted to introduce my followers to Dr. Julia Jackson, oral surgeon in Philadelphia, and we met because she had seen or read my book, The Entrepreneur Dentist. And before I forget, I do have a new one, Financial Literacy for Dentists. But we were talking and we talked before. We had so many things in common. She's an entrepreneur, oral surgeon. Most of the time, oral surgeons aren't that entrepreneurial. Most of them are just surgeons. They're clinicians, and you happen to be um, entrepreneur. So you're doing a lot of things. And if you'd like, I think, I'd like for you to introduce yourself. Kind of give a little bit about your background, what you got going on, and what you have. And we're bi-coastal now, so I like this thing where we start to working together on some things and try to find synergies between the East Coast, West Coast. Let's make it happen.
Absolutely. Dr. Lanier, you are a mentor in your own right. I don't even know if you realize it. I'm going to mimic you. I wrote a book too. It's called Training Ivy by Dr. Julia Jackson. And it's a little book with a big title. It's called How to Become the First Practicing Female African American Oral and Maxillofacial Surgeon in both the Commonwealth of Pennsylvania and the Commonwealth of Virginia. All that here in the small writing here.
That is interesting. That's an interesting subtitle, yes.
It's on Amazon, and it gives a description of my travels from high school in Philadelphia. I am from Philadelphia. You're right, Dr. Lanier. And also my experience in university, being in college in Connecticut, Wesleyan University. And then it meanders into how did I get into dental school in Philadelphia at Temple Dental. And so that's a little bit about me and a little bit about my book. After I finished Temple Dental in 2005, I started my oral surgery residency. I eventually 6 years of training and finishing in 2011. And being a practicing oral and maxillofacial surgeon here in Virginia for more than 15 years. So,
okay, that's right. You're in Virginia now. What part of Virginia are you in?
I live in Annandale, Virginia, and I practiced in Annandale, Woodbridge, and Manassas consistently for 10 years in the same location at a DSO, Dr. Lanier. So we need to talk about DSO and what it means to work for a DSO, and also, Dr. Lanier, what it means to be a DSO owner and operator such as yourself. We admire you.
Oh, okay. That's a topic I love talking about, the DSOs. But I see you have something going on in the back behind you there, your banner.
Yes.
Talk a little bit about that and tell me about this. What is it? The International Institute,
Yes.
International Implant Institute.
Yes. Thank you, Dr. Lanier. I started a continuing education program. We are CERP accredited and we are PACE accredited to teach general dentists how to do more advanced procedures. I really have an admiration for general dentists. I believe that they can do and should be doing more advanced procedures. I feel as though the dental schools kind of foreshorten the experience and keep them kind of hindered to being able to do surgical procedures and force them to refer them out. I know that surgically, the skill set is there. I think the time management skill set is there. So it's really just the empowering and the encouraging to get general dentists to do procedures such as implant placement, socket grafting procedures, making sure they're doing atraumatic extractions. It all starts with extractions. We teach them how to place IVs. We teach them suturing workshops and techniques. So it really is things that just make them feel more confident and broader range in their surgical capacity.
I like that because one of the things, we try to stick more to pediatrics. That's my core, even though I'm working now building a GP practice in 2 locations. The thing I find now is recent graduates are reluctant to do what I would think are very basic procedures. Even tomorrow, I'm going to sit in on the doctor's training that my clinical director, who's a pediatric dentist, he does. But I find that most of the GPs, it was kind of shocking to me that I find that most of the GPs can't or won't or afraid to do anterior pulpotomies, pulp crowns. And I'm thinking, wow, that's basic, And sometimes I think with the GPs, you got to get out of your comfort zone. And if you're not comfortable trying something, then shadow someone, get someone to mentor you, get the books and read, but get out of that comfort zone, whereas you only know what you knew when you left dental school, which is very limited, and start really learning by getting experience from people like yourself. So I really like that kind of idea of expanding people beyond where they are. And that's why one of my mottos for my organization now is each one teach one, so that everyone is learning and growing. So I like the learning environment. I like what you're doing there and spreading that. So you have these workshops now, and you do those in just one location, or do you move around?
So I also agree with you, Dr. Lanier. In so many different levels, we have a motto that says, see one, do one, teach one. So as a clinician, I like to make sure that I've seen it, I can do it. And now we want to further mentor and help others. Another point of synergy, Dr. Lanier, is not only do we offer the workshops, but I personally will follow up with any practitioner, go to their office and sit chairside mentoring. We call it chairside concierge surgical service, where if they want to do a pediatric extraction, so we have a 12-year-old who needs an adult tooth removed, instead of referring that pediatric patient to an oral surgeon, they should be able to take out tooth number 19 or 14 on a pediatric child. So we've seen that before too, not just a pulpotomy. I mean, they won't even take.
Oh yeah, right. I've had GPs that want to call. I mean, just for a simple extraction of a bicuspid for the for ortho, and they want to send it out to oral surgeon. I was like, Doc, you should be able to do that. If you don't know, then get around somebody and learn, get some mentoring and shadow, look over your shoulder, ask. And the thing I encourage doctors with also, Dr. Jackson, ask. If you never ask, there's so many people that are willing to mentor, but people don't ask. I mean, and that's the thing. You and I know you, when someone comes to you, ask you about different things, mentoring, it kind of gives you a warm feeling like, hey, this is a person who really wants to learn versus somebody that you see struggling, but they never ask anybody. And I had a situation that I'm going to let you talk about. One of my doctors, she was a GP. It took a long time to get fast doing pedo, but once she got the hang of it, she was like boom, 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 and she could do real. So I send some young doctors over to kind of train with her. And it's a big office. So I said, well, when you get a chance to go in, over the shoulder, so forth, send them over a few days. And then I questioned my doctor, the senior doctor, how did it go? And, as far as training. And she said, he never came in my operatories, never asked me anything. And I was like, wow, how could somebody, and given the opportunity to learn from somebody who had the experience, the speed and everything, and really got, everybody loved the way she works, why wouldn't you spend your time? Is it ego? I don't know. Is it ego? Is it fear? Is it what? I don't know. You could tell me, Doc. What causes that?
That's a good one. I don't know. I don't have that problem. I was always underneath somebody looking carefully, the most curious kid you could find. So I don't know where that apprehension comes from. I have had some participants who seem to be as if they know it all, but the fact that they showed up means that they know that they don't know everything. So there's a little window in helping people who want to know more, but may be apprehensive about expressing their vulnerability of inability to know, their ignorance. So I've had young students where I went to Jamaica to do work in the first or second semester in Jamaica at the dental school for the third and fourth year students.
Okay.
And I was doing a suturing tutorial with mangoes. I had all the students get mangoes, and we're all sitting around, and the young female students were very eager. Show me, Dr. Jackson, show me. But occasionally we'll get a male who says, I know how to do it. I can do this, or someone else already taught me how to do this. So they want to show that they can do it too. So there's a lot of
Yeah,
reasons why sometimes people may feel, I think it's just like a know-it-all. I've had sometimes where a female will take a course, which I love when women take our courses, because I feel like they should definitely be open to surgical opportunities. And they will say things like, well, I don't do that at my practice. And I'll say, I know, that's why I'm here to teach you what else you can do at your practice, or other ways that you can do things. Because some of our students are either people who have been in practice for many years and want to open new horizons to doing implant placement cases and prosthetically driven implant placement cases. So they're ready to expand, but not really. They're still stuck in their old ways. So they want to learn more, but they do see what comes naturally to them, versus the
yeah,
new grads that we get that knows nothing. I mean, sometimes I wonder what happened with COVID. A lot of the graduates never really had any hands-on experience. They graduated with very little
yeah.
exposure to real life procedures. So now
Everything was on a typodont.
could have been on a typhoid or not at all. You know, you know,
Right,
that's the one is where they tell me they took out 4 teeth. How do you take out 4 teeth in a 4-year program?
right.
So I see all the gambit of educated or people who want more education. I think that's the beauty of continuing education, is
It
to
is.
see the different ranges. We try to accommodate and customize our curriculum to fit the profile of the participant. So if we have a participant who's placed multiple implants and now wants to learn sinus lifts, okay, look at you.
Right.
That's
Moving
part of
on.
the beauty of having a multi-specialty faculty. We have prosthodontists, we have oral surgeons, we have periodontists who can match the level of understanding that the participant has. Those that are shy, well, get over being shy. You can't be shy around me. I'm going to get it out of you somehow.
Yeah, that's good because you're a natural teacher. And you were saying about CERP and PACE certified.
Yes.
That takes a lot to get that. Michelle's working on that for me right now. We do just California certification, but we are working on trying to get the CERP and PACE, so that. But we can talk about that some more later on as well.
Dr. Lanier, are you a pediatrician?
No,
Pediatric?
I'm a general dentist that wound up doing, and one thing I did quite a bit of as well was oral surgery. I wound up at a clinic in New Orleans because I went to school on a public health scholarship. But when I reached the clinic, it was in New Orleans in the housing project, the St. Thomas housing projects. And there was a lot of kids. There was a pediatric dentist there when I arrived, but he was already ready to rotate out. So we overlapped by 3 months. And then it was myself and another GP. So we both did a lot of pediatrics because it was kids that's rolling through, but then adults as well. We could do everything within an hour or hour and a half for $11. But a lot of times people would come there and they need extraction, the adults, and there was nobody to send them to because, these are poor, indigent people in the housing projects. So the other dentist was refusing to, but I had this Archer textbook. And it had a lot of illustrations, pictures, and so forth. So I said, well, since I can't refer them out, and I was a public health dentist, you can't really sue me. You could sue public health. So they cover, once you're in the military, public health the same as being in the military. So I started trying, and sometimes I get halfway through and I said, oh, let me grab another instrument. I run in the back and I turn to that page again. And then I was like, okay, this kind of matches this picture. Maybe I need to angle a little bit more and section a little bit more. And I became pretty good at doing oral surgery just by trying and following that book on a lot of things. And then I learned the pedo from a friend of mine who was friends with the pediatric dentist there. It's only one Black pediatric dentist in New Orleans when I was there, John Barnett, and he taught both of us a lot of pediatrics so that we could go back to the housing projects and take care of it. And that was, but by the time I moved to California, I I created this card, GP for pedo, and I was just freelancing. I put a little ad in the dental shopper, dental trader. They had these books, and people started calling, and that's where I started one. And then when I got a chance to work at a big pediatric office, they had 3 pediatric dentists there, and they all let me shadow. So I was like, wow, I've got an education just by coming and working with those guys.
That's called self-taught, Dr. Lanier. Self-taught pediatric dentist.
And those are needed because in the minority community, and whereas the underserved, I don't say minority, underserved communities, you got to be able to do a little bit of everything, because you can't get specialists for all of those people. Somebody have to be able to do it. And if every time we're doing something, we get, let me refer this out, they're not going to get the treatment.
I think the self-taught pediatric dentist is a very good start. Not only are you a self-taught pediatric dentist, but you're a made millionaire. How did a self-made entrepreneur, Dr. Lanier?
Yeah, I think that was already kind of in me when I got to dental school. I sold books door to door. Used to sell the Ebony Pictorial Library and some handbooks right before I went to dental school. It was a challenge when I was coming out of college, and they had this group that were recruiting college students to go. They go to Nashville, train for a week, and get all the inspiration and motivation, and then they send you, kind of reach in the hat and you pull out a name, and I pulled out Detroit. For some reason, I don't know. So I sold books door to door in Detroit for a full summer, and you sell the books and you buy them from the company. So you become an entrepreneur, because you have to get out, you create your sales, you buy your books, then you sell them and you keep the profit. So by the time I reached dental school, I said, I want to be an entrepreneur and a dentist. So that's how I come up with the name, the entrepreneur dentist, even my book. I said, well, and that's the thing I like is helping other people have what they want, and working with, and there's so many doctors that don't want to ever own a business.
Right.
And they prefer, even though they think it's security, I think it's more security in being an entrepreneur than it is being an employee,
That's one we need to discuss. I've never owned my own practice.
Really?
Right. Never. I never wanted to be responsible for changing the light bulbs or taking the new lady at the front desk because she's going through a maternity leave. I didn't want to do anything to have to do with insurance. My job is oral surgery, oral and maxillofacial surgery. I'm a people person. I like to communicate with the patients. I would like to set the cases up financially, get the patient ready, focused, not on their needs, but more importantly, I should say it differently, not on their wants, but more importantly on their needs, and making sure that they knew that those two could come together. And then I'd have the little lady come in, implant coordinator, and she'd hit it out of the box. And that's what my job was. And I would love to do tori reduction or impacted third molars, some type of procedure that was slightly a challenge, or the patient that came in because the general dentist had taken more than 4 hours to take out one tooth, and it was swollen and it was bleeding and it took too long. That was it.
That's your lane.
That was my lane.
And when that's your lane, I had a friend used to say, Doc, stay in your lane, stay in your lane. And when you do, you really get good at it. And that's staying focused. The thing I encourage ownership for is accumulating wealth. It is hard to accumulate wealth unless you accumulate assets or equities in something. And once you are owner of equity or assets, then they appreciate over time. If you, let's say, for instance, you get a practice, but the thing is, like you said, you like having that team. And that's the thing you have to do, though. If you're going to be an owner, you do have to build a team, and you have to write your "this is how we do it" book for the office, or your systems, how your system works, because sometimes people come in and And they say, well, over where I used to work, this is the way we do it. And you have to tell them, listen, I appreciate that, but this is not the way we do it here. This is how we do it, and this is how it's going to be expected. And over time, you kind of write that into, after a while, people start to understand, but you need to document it as far as systems so that each time someone else comes in, it's easier for them to understand, get trained on it, and so forth. But the other thing I will say about ownership is the thing that I really encourage people to look into is leverage. Because if you, as a dentist, if you could go to an institution and get 100% financing, they're going to finance it 100%. The only thing that would hold a person back is either they don't know or they really, like you said, don't like doing those things. But if you have a team, like I have operations managers and then you have regional manager and office manager. So probably too many managers here, and then you have your back office supervisors and so forth. But once you have that team built and everyone knows what they're supposed to do, then you could go back to being the clinician until you get several practices going. After a point, you get to the point where you can no longer sit in the chair because every time you sit down, somebody's running, and they got something else, and that's a distraction. So until you get to the point, I guess if you really grow and you could put your CEO in place, then the CEO is doing it. But it's hard to do both after you get really, really busy. It's hard to do clinical. That was something I had to go through because they kept scheduling me and so forth. And I was like, I can't do it. I can't do both things at the same time. So that was the reason I backed away. But I really enjoyed doing clinical.
How
Yes.
many offices total have you run at one time or had your team running total?
I think 15 was the max that we had at one time.
Okay.
And I during that time I sold a couple and then picked more up, and then I sold another and so forth. But when I sold to Western Dental, I had 14. And that was busy trying to get around to all of the different offices. It gets busy, and it's a lot of stuff coming at you. I'm getting busy again, and I only have 5. I'm closing escrow on 2 more, but there's a certain point that you try to bring in management because I'm reaching a time where I want to step back again and play my guitar and just kind of do that thing. And I did take a year off, Doc. When I moved from New Orleans to LA, I took a year sabbatical and went to music school. And I don't regret it at all. I still can't play. But it was fun hanging out with the young kids and just learning from. Now, you had mentioned something once about you have an event coming up, that a training. When is that and where is it at?
Okay.
Or is it that online?
I'm going to cover that. I want to go back. You have so many things, Dr. Lanier. The first thing I want to say is we also have a term where we say thinking outside the socket, which means that we are not just in our regular little box.
Right.
As entrepreneurs, we're thinking outside the socket. So I say that I never purchased my own location, but I have purchased assets and equity in residential properties. So I didn't own my own business, but instead I own a property in Florida, 2 properties in DC, including an apartment building. So I have ways of making sure that I have the same kind of team, not so much on operations and a regional manager and the same dental team, but a team that helps with the properties, which helps with generational wealth. So I may not have owned my own business, but certainly want to be able to carry wealth into the generations that are in front of me. That way they will be able to manage a property. It doesn't have to be a dental office, because what happens from my experience is we all have dentists who do get to own 15 and 14 practices, and their children don't want to have anything to do with dentistry.
Right.
So I don't want to limit my future generation that it has to be dentistry. I want to make sure that they can have a team for residential home property management, that maybe they can hire a team where they can just collect the rent. So I totally agree with you that finding a way of putting your money in investments is critical, especially
Yes.
for entrepreneur, dentist, African American people of color. We want to have wealth through our generations because that was new to us. You know, people before us couldn't even get financing. But when you say
True.
100% financing, I step like, I don't want any of that. I don't have any
Yeah.
debt. I don't have any bills. Like, I don't have any outstanding loans of any sort other than a mortgage, which seems to pay for itself with the rents. And so I thought what you said were very critical and pivotal points where, yes, we can be entrepreneurs and run a practice, but you're right. To my surprise, recently, I have stepped away from private practice. So I'm not doing a year in music school, but I feel like I'm doing 2 years in like business management. I'm learning marketing from you. I'm getting mentorship from other people that I would never be exposed to. I'm outside of the socket now. You know, I'm
Yeah.
outside of the little confines of the mouth, the anatomy of the curvature of the root structures. So my head is out. I'm trying to figure out what is SEO, what is a key opinion leader, what is a learning management system for my
So
online
you going,
courses. Exactly. I'm getting I don't know, crash course in figuring out CEO and business management outside of the dental environment. And I would love to share my
yes,
experiences with your audience because I'm sure
yes,
that there are people who still don't want to own a practice. I did make
right.
a significant income as a employee of a DSO. It's
Okay.
really breathtaking, or I'll say a breath of fresh air to hear you as a general dentist owning and operating 15 to 14 pediatric like operations there, you know, and then hearing that Weston Dental bought you. That's unbelievable.
Yeah, that was it was a great experience.
I'm sure. And we
Yes.
want to know about it. Yeah. So I do
It
have
was a great experience.
I do
Go
have
ahead.
the online courses coming up just this Thursday, the 23rd. We're going to be talking about vertical sinus lifts. That's inside the crest versus a lateral wall sinus lift. So
Now, is this online or
yes,
live?
it's
Online. Okay.
online and it's 1.5 CE. It will be April 23rd. And it should be a really good conversation utilizing densa burrs, which is a specific kind of burr that moves the bone versus removes the bone. So we do want to make sure people understand how to do a vertical sinus lift. We do have our hands-on course. If anyone's ready to do prosthetically driven implant placement, April 27th through May 1st, we are still welcoming anyone who wants to come to Manassas, Virginia. And we have a 5-day course, which includes advanced cardiac life support, basic life support, and pediatric life support. Again, that's April 27th through May 1st. And then we have a webinar April 23rd. So we have a lot of things going on. I too get pulled in different directions, asked to do this, trying to figure out how to do my own marketing, Dr. Lanier.
You're doing a good job. What is your website again?
Yes, the website, you can find me at extractionjackson.com. That's pretty easy.
Extraction Jackson.
I take out teeth, Extraction Jackson. But you can also find us at International, which is INT Implant Institute, INSTITUTE.com, International Implant Institute. We are a continuing education program to teach general dentists in a plethora of topics. Medical billing in dentistry, that would be for staff and hygiene. We've had nitrous courses. We have a hands-on model surgery course. We're going to Cancun in July to place implants on live patients.
Wow.
We have it going.
I see. You're a real entrepreneur, and I like what you were saying earlier about your investments in real estate. Also, even stocks and bonds, that's still owning equity and something. I really like real estate because it's there and it's easy. I like real estate because my son doesn't want to be a dentist. I know my daughter doesn't. And so I think for me, owning the real estate and the office, I tell my wife when I'm gone, just sell the practices and keep the real estate, and be a landlord. And I think that works well. And that way you can pass on generational wealth to the next, and the next, and just take care of it. So I think what you're doing is very entrepreneurial. You get a chance to stay in your lane, do what you love doing, and then learn and do some of these other things. Like you said, you're still learning, and I am as well, like SEO, and as it changes. SEO was this yesterday, and now with all the AI, SEO starts to being something different, and you can't really stop. You're learning, you have to keep going. I think it's good for me because I've gotten old, and they said the best thing to prevent Alzheimer's, or as a friend of mine called it, old timers, to prevent old timers disease is to keep learning something. I think it stimulates different pathways in your brain, and it keeps it moving and keep you learning and growing. So I'm loving it, Doc. I'm loving it. And especially meeting people like yourself that have stepped out there and doing different things. I think it's it's motivational for other people that are listening, and also learning from someone like you, because it takes a certain personality like yours to get out there, bring people in, train them, and mentor. And that's what I think the beauty of it. You think this we'll put the link below for the websites and the dates and so forth going on, so that we can get the audience to visit your site. I like your website, has a lot of things that someone did a good job on that. So I like that. And we're working ours. We're constantly trying to update and keep things going. The big part of it, building the website. But now I'm finding that with the AI, you don't have to necessarily send them to the website every time. Now, if you do it right, it'll just recommend you by doing something. I don't know exactly how it works.
Pages. Yes.
So that's beautiful.
I have a question for you. Are
Sure.
you providing mentor services or mentor opportunities for people to learn from you about how to start a DSO?
I am. And the event that I was planning to do on May 1st, it was really about how to start. And I may do it online because we aren't getting enough people to fill the room in Vegas. So I decided rather than do it in Vegas, we'll just do a live training. But that's part of the thing that I really want to. And I had a guest speaker who's from it that helped set up my DSO. He didn't set up the first one, but I wanted this one to be a certain way. And I went to different law firms. Just so happened that this one, well, the pool again.
What's his name? Is his name Brian?
Brian, yes. Brian Kaleo, who is he's a principal at Dykema, but he and I had known each other for quite some time. So I started going back and forth with him about what I was trying to set up. And he said, yes, we can make it happen. So once he got me inside the system, it's working with different attorneys, and it's a process. It takes some time, and it takes some investment, some money to really get it off the ground, to get everything laid out. And then I think, though, to set up the DSO, you have to have kind of a idea of scaling, because you don't want to spend that kind of money and just do one or two practices. You got to see it from a big picture. So you're setting it up to allow you to scale. And that's what we're doing. This one, we're partnering with doctors. So we have a DSO, but it has tracking units. So each one, think of it like a McDonald's franchise, basically, by a different name, because if you say franchise, then they want to send you through different laws. If you have a franchise, they have a headquarters, and then they have multiple offices that different franchisees can own. But what you do in your franchise is you want to track just that. What is the revenues? What's the expenses? What's the profit? And how do we get better by looking at the KPIs or the key performance indicators? What are we doing to grow here? And how does that appreciate every year and you keep growing. And if it starts from a baseline of zero and 3 years from now it's doing $3 million and at about 30 or 33%, you're about $1 million in equity if you own a third of the practice. So that way a person has not only gotten paid, but they're also their equity has grown, and now they just pay off whatever the loan is, and then the rest of it is their profit if they want to sell it, or you just keep it and grow it. The one thing about that is it's always easy to sell to another doctor if you bring one in and you teach them how to do what you do. That way you can step away, they could take over the practice, you get paid, and everything just keep rolling over. I like that idea because when I owned Kids Dental Care, I owned 100%. And when you own 100%, you're 100% owner of problems and the good and the bad. So you want to share some of that. You don't want to have to do everything by yourself. So I love partnering. That was why when we started talking, I looked for ways that we could find synergies and going in the same direction, we can grow and scale. I think especially in the African American community, though, it's a lot of skepticism between us and establishing trust that sometimes, hopefully I don't offend anybody, and I'm not saying it should, but sometimes we tend to trust the others rather than trust each other. You know what I mean? And it's just really hard sometimes to get the buy-in. Maybe, I could tell, it's easy for someone else outside to say, well, you're the leader. I don't know. But with us is like, damn, I've been doing this for a long time. You got to give me a shot and let me. That's why I keep writing the books to show people that I really do know these things. And the last one, like I said, the financial literacy, is a small book. It's not a lot, but it's packed with gems of things that I think a person that is interested in setting up a practice, knowing what EBITDA is, why you need to understand how you exit a practice, but all of those things so that we can kind of mentor them and find ways, if there are synergies, opportunities to work together and create other things.
Met Brian. We were both on the main stage at a conference called Women in DSO.
Oh, yeah.
Brian spoke on behalf of DICOMA, and he's a strong advocate for women in DSO. And I was very fortunate to be asked to speak at Women in DSO in October in Washington, D.C. I spoke about thinking outside the socket and what does it mean to do something outside of our regular clinical structure of dentistry. Brian is a very powerful and passionate speaker. It was good to be in the same arena. And I think that when you talk about the total mind change and like paradigm shift of thought that's required to scale up, we have a lot of us practitioners haven't gotten to that yet. That's like advanced thought process that we haven't. There's some of us peaking and some of us interested, but none of us have really jumped out there. And I hear what you're saying, that there is a trust fear factor. Who can I ask? Who can I emulate? Who can be my role model? Say that has done this and will be willing to take me under their wing, because it's strange enough, Dr. Lanier, it may be that you see that people don't trust you per se, even though you've done this. But the way that I see it is people don't trust that I could do it. So they're kind of like, well, I don't know. She says she's interested, but does she really have what it takes? Hell yeah, I have what it takes. But I can't find the mentor who will say, hey, you got a good idea, and why don't you try these things? And not just try them, but show me how to implement them. Tell me that this is the special sauce. These are the ingredients. Or more importantly, what you're doing, Dr. Lanier, is just you be you. And let me ask you all the questions I can think of to figure out how in the world would I actually have other people to come together and establish a DSO. It's one thing for me to get it on board, but you're right, getting others to understand the acquisition part. And Dr. Lanier, I just wanted to mention one thing. I mentioned that I worked at a DSO for 10 years. I guess it's okay to say this. It's called Dental Care Alliance. We were the first oral surgery practice that they acquired. So we were really in the beginning of their forming.
Okay.
And once they acquired us, it was the kind of DSO, which I hope the listening audience understands. DSO, in my opinion, is very much like sneakers. You can have Nike, you can have Reebok, you can have K-Swiss. They're all called sneakers, but they each have their own way of doing things. Some,
Right.
like Aspen, take your entire name and now you're Aspen, versus mine, which meant we were just affiliated together. So it was still called
Yes.
Northern Virginia Oral Surgery, but we were affiliated with this Dental Care Alliance. So Dental Care Alliance eventually bought practices from Massachusetts to Miami. So it got very big, maybe over 400 practices. And one of the things that we started to realize is that they didn't understand, as specialists, that we needed to have a business so we could take general dentists out to lunch and kind of wine and dine our referrals, and more importantly, have networking events and communication outside of dentistry. That's a form of marketing that we as specialists need to do. So they would start to restrict our business relationships. And now that I've left this DSO, 2 years, I just read in the paper, one of the things that I can say is a trial and tribulation with DSO is that the DSO asked all of the practitioners to buy in to the DSO. So we all got a little bit of money and we put it into the DSO. And what it did is it looked like it was more valuable than it really was. They call that what you've referred to as leverage. So they showed a new company that our company was very valuable because it had monies that were collected by all the practitioners. Does that make sense?
Yes. Okay.
Right. And so then the EBITDA appeared to be more valuable. And we, as the practitioners, were told, we're going to be able to sell this for 14 times the EBITDA because all of these people have put money in. Well, lo and behold, eventually I did get my money out. But that company that purchased the DSO found out that the DSO was over leveraged. And now Dental Care Alliance appears to be, for a lack of a better word, bankrupt because their amounts of money that they were giving out for whatever reason, maybe purchasing for marketing or maybe purchasing for something or paying for something, it didn't equate to the amount of money that they said they were worth.
And now let me ask you, was it there because when they sell or to another private equity company, it's called recapitalization?
Yes, a turn. Yes.
Yeah, so recap. But if they're in their fourth or fifth recap, they may go to 14, but overall, the last time they sold at 12. Now they're going from 12 to 14. If you come in, yes, they might be going to 14, but they're already at 12. So you only move 2%. And then what happens, and that's the reason a lot of times these private equity it could be very deceptive because they, like you said, they can go in and leverage everything because once it's in their name, everything is in their name. They could go in and they could change the rent on the building. They could sell the assets and then put a lot of debt on it. Yeah. They're going to walk away with the bank and the doctors are sitting there like, what happened? Because, and that's the thing I really caution people when you get a call from a DSO. One of the good things is I created a list not too long ago. I'll attach that as well of things, questions that you should ask and what you should put into maybe program into AI and just let it answer all of those questions. And it brings a person's awareness up like, wow, I didn't know it worked like that. And that private equity, and I'll make this example and move. But everybody knows the Red Lobster story, how there used to be Red Lobsters everywhere. And they claim that the reason that they had to go bankrupt was because of the all-you-can-eat shrimp. Mm-hmm. That put them a little bit in debt, but it wasn't that. The company that bought it, the private equity company, came in and bought it, and they owned a lot of these locations. they sell the locations and do a lease back at a very high rate. Now they have stacked all of this debt on top of the company. They sold it and made all of the money on the real estate. Then they sell the company, make a lot of money on that. But now it's over leveraged. And so a lot of times I see that doctors will sign something, they get selling their practice that they've taken years to build, and they get like a five times EBITDA on the 60%. But then the 40% they leave on the table, they have to wait and do an earn out. And sometimes it could take years. You're working for somebody else. Now they're the boss. It was your business. Now you're working for them, and now they can put debt on your building, debt on the practice, and then they can tell you how it's going to run at that point. It's not always good. I'm not saying it's because I have a DSO. And like you said, there's so many out there. And if you find some that are unethical, that's what you're gonna wind up with. So it's always good to put a little knowledge in your head before going down that road, or at least talk to somebody that knows. And that's the thing I encourage people. But most of the time, like I said, people refuse to ask. No, I already know. I've heard that before. Well, go ahead with your bad self. Let's see what happens,
Yes. So one of the pearls of wisdom that we learned is that DSOs buying up all these practices is no longer the way to show that the DSO is profitable or functional. It's not how many practices do you buy up, but how well are you running the few practices that you have?
Yes.
Because when they actually ended up buying up 400, they certainly weren't able to manage the expense of the 400 of them, and now they're belly up. So
Yeah.
we're seeing that that's a
Yeah.
little bit of a change of thought process, because remember, it was always about, well, yes, this DSO has 14 different locations, or 17 or 32. It was more practice acquisition.
Yeah, and that's the thing. A lot of doctors are bragging about how many they grab and put together. But if you're just duct taping all of it together, it doesn't really work. Because if you buy this practice that works like this, and this one over here, and now all of them are functioning differently, you really don't have that much synergy. So they call it like a duct tape DSO. And it's all in a person's head like, wow, I own 10 practices. But they're going downhill because you didn't build a system in, and all of them are disparate parts. And unless you can align everything, now it starts to get the economies of scale, and you can run, and you don't have all of those headaches. But yeah, that's the thing. I think that growth, a lot of times, and people were doing too much of that. And you'd be surprised. No, you probably wouldn't. But over the years, how many people would approach me? They wanted me to put my company inside their company. And I was like, sounds shady already. I don't want to be putting, as hard as I work, I've been beat because I'm a country boy, so I gotten beaten ever since I left home, even with the 3-car Monty. I thought that I could tell what was going on first time I left home. Somebody beat me on that. They beat me in DC at the bus station, sold me a watch that was, supposedly gold. I've gotten beaten everywhere. So it took me a while, but with the practices, I worked so damn hard. I was like, no, I can't just give you this. I don't want to, I can't crush you. Yeah, I learned already. I kept, that's why I kept 100% of mine. But this time I know enough that I can create something, and it can be transparent. That when the doctor comes in, the equity that they own, and it's like getting started. If I own 60% and they own 40%, it's like getting started with the big brother, or riding a bike with training wheels. Right. You're already not going to fall over, because if you fall and hit the ground, I'm falling and hitting the ground. Right. So I'm there to help them, and I can mentor them, and they can watch. And when it says tracking units, the only thing really, like I said, that they're tracking is what's going on at their location, whether it be the revenues and the expenses. But we have the support services like the operations manager, HR, everything, IT, all of that is corporate. And so the doctor doesn't have to worry about that. They can get up and go home. And then the only thing they need to do is get their profit and loss statement, look at that, and kind of steer. It's like your what do you call it? Your control panel. And that's the model that we built. And Brian, like I said, through Dykema, they helped kind of engineer that whole process. So I think it's a beautiful thing, and that's what I'm out here peddling now, along with my books. But I think it's just good, when someone is learning and earning at the same time, learning and earning. So that's the great thing about what I'm hoping to do. And I like mentoring, with people that really want to learn rather than trying to beat somebody. I'd like to, before I forget, as an oral surgeon doctor, make sure you're teaching them how to give great local anesthetic. I find so many, because I've gotten dentistry done. I go to doctors and they can't give a block, or the ones that's trying to do pedo want to get the short needle. I made them stop buying those because everything they just want to infiltrate a little bit here and there. And I'm thinking you need a little bit longer because even if you want to do a block, you can't do a block with that little short needle. Don't order those anymore. And really give a good block. Because, I had a doctor working on me on number 18, 19, couldn't get it numb. And then it's just trying infiltration, missing everything. And it basically pissed me off. And I'm like, Doc, you need to bisect the angle of the manual. You put a little here and let it drain down. And I'm trying to school him. But I was like, damn, you have a license. You can't give anesthesia, So, yeah, I wanted to get that in before I forget. It's needed.
They can find out not only what does it take to become an oral surgeon, but once you get to be an oral surgeon, how do you maneuver? And also, how do you give profound anesthesia? So absolutely, it is all covered from soup to nuts, and a little bit of where did I come from and how did I have a gumption to pursue being an entrepreneur in addition to being a practitioner, a clinical practitioner. So yes, I agree with you, Dr. Lanier, on so many levels. Absolutely.
Yes, I think that this is great, Doc. I'm looking forward to us working together, and I want to attend one of your seminars and just kind of get the feel of it so that I can relate it to the people I'm working with. I still maintain a license. I haven't practiced in about 15 years, but I maintain a license and I have to get my CE credits in. So I can get some CE credits in with you.
Yes. Yeah. Sign up for April 23rd. It's going to be vertical sinus lifts, a little out of your wheelhouse. It'll be new information to bring you some basic understanding of sinus lifts.
Okay.
And I think it'll be a great experience to see how does International Implant Institute work. You'll get a certificate of completion. You will receive your CE credit, and you can find us at International INTL Implant Institute. And also, Dr. Lanier, I guess maybe on the record or also off the record, I'd like to ask some more questions about who on your team helps people go over profit and loss statements and QuickBooks? And also, how do you help people specifically when they're ready to scale, buying multiple practices versus what is franchising? What does it mean to copyright and licensures? How does that all play into dentistry and other avenues of entrepreneurship?
Like I said, this book, The Financial Literacy, is kind of the heart and the start of learning about these terminologies, the different things that happen. I think a lot of times a term that I learned that really kind of makes a person delve off into really understanding is DSO arbitrage. Arbitrage is actually just moving it from one platform to another at a different multiple. And I think once they kind of understand that and multiple arbitrage is called, then it starts to makes you go deeper down the rabbit hole. Multiple arbitrage of what? EBITDA. And what is EBITDA? And then it goes, once you start down the rabbit hole, and that's the all of those terms we cover in the book. Then for just mentoring, mostly what I've been doing is I've been doing some just one-on-one mentoring, but now I'm moving it more to classroom type mentoring. But I want to also start forums whereas we can get other people that are sending their comments and questions so that everybody else benefits. So when I do podcasts, I'm trying to do podcasts now again that people can ask questions and we can answer while someone else, because if a person asks one question, it benefits everyone else that's listening. And even if they aren't listening live, then it's recorded and we can put it on. So that's basically my way of mentoring right now.
Okay. Can you put up your book again? I'm going to take a picture.
Okay, good. Yes.
Absolutely. Perfect. Thank you,
But
Dr.
that's all
Lanier.
that's important. Well, let me tell you guys, make sure it's this one because someone actually stole the name and did another one, but he's not Dr. Jerry Lanier, DDS, and MBA, entrepreneur dentist. And this one, the dark black cover, and the other one is another color, whatever. But this one is the one that you want.
When did you get your MBA, Dr. Lanier?
God, it's probably about 10, 12 years ago. And it's an executive MBA. It's not the full MBA. The executive MBA, I took classes at UCLA, and I think it was just like a couple of semesters, like evening classes at UCLA Anderson School. It was good, but my main thing is I think that, and I have a doctor that's starting an MBA course now, but it's the full MBA. But the thing I learned and then I walked away with, most of the stuff I already kind of understood, but the thing it did for me was confirmation, especially as far as scale. Maybe I went there with one thing in mind and it just confirmed that, and everything else is like just going, but I was like, damn right, you got to scale. And that is a big thing because, with all the DSOs and most businesses, if you can scale and understand that scale requires a system, you can't just scale chaotically. You have to have a system so that everything is under control and you grow. So systems are the solution. That was part of the whole thing with Michael Gerber. And you build your systems. And that's the reason a lot of times people think they can start something and it's overnight riches. It really can't happen like that because you have to build it. Somebody has to build it. And if you're the person with with the imagination, then it's already in your head. You have to just build a system so that everybody around you can help you get to where you want to go. And then you start bringing in the resources and you can tell that this person, it'll work, but this one doesn't fit in because it doesn't understand the system, not willing to use the system. This one does, and so forth. So you build the resources and you just keep moving and growing. But I'll say this before we end. Every step or every level, I think, Doc, you got to start again. You're learning because you can't move. Once you go to the next level, you'll plateau. And unless you learn something new, you're going to stay there. You got to keep growing every time. And then your knowledge base grow and then the company grows. Your knowledge base grows, and it's just like that because you're the leader and you're pulling everybody else along with you.
Beautiful. Oh, it sounds like poetry.
Right. Doc, it's been a real pleasure. I'm so happy, and we're going to put this online, and we're going to schedule something else. And like I said, I'll sign up for your class, and let's see where we can take this thing. And everybody out there that's listening, just join us. And you're going to find ways that we can work together to get to that next phase. She's a doctor who's been through some things with the DSOs, and I have as well, and learning. Let's help you get to the place that you want to go. And if you plateaued, let's get you to that next level. So I think that this is a great thing. Thank you so much for joining us, Doc. All right. Take care.
Thank you.
All right.